adjusting optimally from one situation to another, one context to another, has to do with flexibility. It's our ability to adapt. And so it's closely connected to our well-being or the lack thereof. But is there a way to see flexibility in the therapy room? And is there such a thing as too much flexibility? Welcome to the Art of Therapy, Season 2, Episode 17.
I feel like every time that we have an episode, every time that we record, we really go into the detail and into the nitty-gritty of relationships and how it relates to mental health.
Yes, we really are.
So just to take a step back, so the last time we really had a look at the principle of control, and it's a difficult one. It's a topic that is actually very sensitive, and that's hard to look at. And both for anyone as well as a therapist, being able to look at that within themselves and understanding control, but also being able to identify it with clients and what they come with. So it's hard, and it feels like sometimes it's an uncomfortable one. It's not one that's comfortable to be looked at, but it's actually so important to be clinically looking at it and to understand it, and to understand to what degree is a client effective in controlling the environment, and when are they maybe overly control and having excessive control or having a lack of control, because all of these can have such an impact on our mental health and how we relate. But it's a hard one. It's a hard one to look at.
It is. And you're so right that it is really uncomfortable. It's hard. And for many of us, it's very threatening. It brings up a lot of anxiety.
Yes.
For some reason, we receive feedback about it. I think because for many of us, control or lack thereof is part of the heart of how we relate to the world and those around us. So it's a difficult one. And often there's a lot of value judgment associated with control and in society. So it's hard and it's often very threatening.
It really is, but it's also, like you said, the last time, it's so valuable. So because if we look at something like depression, it really becomes a cornerstone of understanding depression. And if you can understand it, you can assist someone with it.
That's it. That's what's so empowering. Once, as a therapist, one begins to look more closely at control and can be able to make sense of it, describe it in terms of the client and the client's significant others, then, especially if that's going to relate to the presenting problem, as in depression, well, now we see one of those cornerstones that's sort of lit up, as it were, which is powerlessness. But that means the therapist can do something.
Yes.
Because so often therapists feel for something like depression or very serious psychiatric or mental issues that it can only be medication. But no, once you can begin to describe and understand interactionally, you can begin to change that. And that's incredibly empowering as a therapist. And it's so rewarding and fulfilling to be able to help someone and in some meaningful way.
Yes.
So yes, it's really needed and it's worth it.
It's hard, but it's definitely worth it.
Yes.
Yeah, so when the last time you touched on that, it also has to be, it's in a different context and it has to be a fit. So that links to some flexibility and understanding that and unpacking that a bit today.
Yes. This is another difficult one, as it were, because, but before we go into it, let's just step back. Okay. Our capacity and effectiveness as people, as human beings, depends on our ability to adapt to the given environment. And to the extent that we're in different environments, different circumstances, different relationships, different interactions, we've got to be able to change. And we've got to be able to adapt. So there needs to be a goodness of fit. And just because we are able to be effective in one environment doesn't mean that same communication, that same way of relating, that same behavior is going to be equally effective in another environment or a different circumstance or relationship. So as human beings, we're constantly faced with this challenge of adapting to the given environment. And to the extent that we are able to make the necessary changes and have just the right response and a meaningful one, an effective one within that environment. And then as we move to another environment or interaction, that we can similarly adapt to that and produce and relate. I said produce, but it's producing a meaningful behavior in communication. And then the next environment. So it requires of us to be constantly changing. So the heart of this is that it goes to flexibility or lack thereof. And it's a difficult one because it's not an absolute. Again, we can be really adept and very effectively functioning in one relational interaction. And then just a moment later, when we're in a different kind of interaction, requiring different skills in communication, we may not be as effective.
Yes.
But all of this is going to impact on our mental well-being.
When you talk about it, it takes me back to an example that both you and Prof. Charl talked about in our master's training. And that example was about someone that's in the military, and that's someone that can really take charge and can give orders and can take charge of the troops, and that is extremely effective and it's
Yes.
needed. However, if they have the same way of relating at home with their partner and their children, there can be some difficulty in that.
Indeed. That's a beautiful example, because that behavior in the military is absolutely indicated for leadership. Soldiers have got to learn to respond very quickly, obey, comply. They cannot be questioning all the orders. And so that can be really effective behavior. But in a marital relationship or a partner relationship, oh boy, that can have a very different impact. Because the moment one's prescribing to a partner and is very forceful and there's very low empathy, that's going to have a different impact.
Really, it's about the situation, about the context that a person finds themselves, and being able to actually identify what it is and then adapting behavior to what is needed in that context.
Yes. I think, if I just reflect on Charl's book, Impact, the Story of Interactional Therapy, he beautifully describes the issue of flexibility and the requirement for that, where in a loving partner relationship, someone, in fact both, but we'll just take the individual, needs to lower control, be closer, warmer within that relationship, and yet within the context of a very demanding senior and supervisor, they've got to be very assertive. They've really got to speak up and manage that interaction very effectively. And yet then if they find themselves, with a senior or someone who's a lot older, and it's all culturally based, but if it's going to their parent who's very aged or elderly, needing to yield and be more following, and that's going to be more respectful and more effective. Again, it's not cast in stone, wrong, right, but what it illustrates is that individual has got to be able to adapt and change their communication, change their way of relating from one interaction to another. And to the extent that they can, they're going to be effective. And it's going to be associated with a higher sense of mental and emotional well-being and relationship satisfaction.
Hi, it's Marizaan, and I would like to tell you something extraordinary happening at Treatment Works. So if you are a healthcare professional and you would really like to deepen your therapeutic skills, training with Dr. Phipps is a must. In my experience, his training is so compassionate, it has high clinical excellence, and it makes therapy so clear. Training is also not just a space to learn, but it's also a space to connect, to share with others and learn from others. So if you are ready to deepen your therapeutic skills and to look at more ways to support your client, join us for training at Treatment Works. You're welcome to visit our website at treatmentworks.co.za.
It really is it's one of the key factors. So being able to understand the environment and then being able to adapt it to what is needed.
Yes. And the challenge here is that we're all, if most of us say, are you flexible? Yes.
Everyone's yes.
flexible. Everyone says yes. But no, we're not. We're not as flexible necessarily as we think. We've got preferred ways of relating. We've got our values. We've got our beliefs. We've got things that we're good at, things that we're not so good at. We tend to often shy away from things we're not so good at, keep doing the things we are good at. So we've most definitely got preferred ways of relating where we feel really comfortable. So we're not necessarily as flexible as we seem or as we think we are. Yeah.
And I think that's where it also comes in again. It's not about right or wrong. It is, and it's not about how you perceive yourself or how a client perceives themselves, but it's looking at it from a clinical perspective, because there it can really being able to understand how a client relates with regards to their flexibility can really link to the present complaint or the reason they came for therapy.
Yes, exactly. It makes such a difference once you begin to observe observe this as a therapist. Because if we just take the life cycle, generally when one is younger, one is extremely flexible and adjusting behaviors, learning, communicating differently. But often the challenge there, it's a catch-22, is lacking experience in how to manage the demands of the environment. But as we generally grow older, we become more experienced.
Yes.
But unfortunately, there's often a loss of flexibility. And so we become less flexible, we become more rigid. So this is something that is so important for our well-being, maintaining flexibility and being flexible and being able to change and adapt and fit from one environment, one interaction to the next. So as a therapist, being able to look at this carefully in terms of the client. Is the client really able to take feedback? Do they act on it? Are they learning? These can be indicators of flexibility. So what's happening in the therapeutic relationship? But then moreover, does the client keep coming back with the same thing, the same behavioral communication, despite feedback? Despite seemingly understanding it, that can be an indication of possible lack of flexibility, continuing to express or exhibit the same kind of behavior or communication. Another way of looking at this is how does the client behave and adapt in different interactions, different relationships. And moreover, it's not only the clients, it's of course their significant others. How flexible are their significant others? And does this relate to the presenting problem?
Yeah, I think it clears it up so much of understanding the flexibility, and that it's at times needed to be flexible and at times needed not to be flexible, and understanding how and when to do that, which will then actually help with how effectively you relate in different contexts.
Yes.
Which of course has an impact on conflict in any type of relationship.
Yes. Yeah, because to the extent that we can adapt and change and mold appropriately
Yes.
for the situation, it's going to be more effective. And that could be more satisfactory. And either that change in behavior and adapting more effectively is going to bring more conflict because it's needed, because conflict's not wrong or right, or it'll lessen it. But either way, it's going to be more effective. And that is going to be related in some way to their emotional, mental well-being and their relationship satisfaction.
So we've really now started to have a look at control, which is very important to our mental health. And now the second one is that we just look at is the flexibility and to what degree someone is flexible, which also seems very important in how we relate, and then to our mental health.
Yes.
So is there another one?
Yes, there is. And this is a concept and an idea from social psychology, which has to do with interpersonal attraction.
Okay.
And it's there in every interaction, and it's something that needs to be considered. However, it also needs a close looking at.
Okay. So maybe we can pause here for today and then look at that the next time.
Yes, let's do that.
Thank you for joining us on the Art of Therapy today. We hope that you find this conversation really thought-provoking and meaningful. And if any of the aspects really resonates with you, please feel free to leave a comment below. Thank you for walking this journey with us. Until the next episode.